Why is TIA medication adherence key to preventing another stroke? Imagine experiencing sudden weakness, speech trouble, or dizziness that clears up within a day. That's often a transient ischemic attack, or TIA, sometimes called a mini-stroke. It happens when blood flow to part of the brain is briefly blocked. While symptoms go away quickly, a TIA is a serious warning sign. It signals that a full stroke could happen soon if underlying issues aren't addressed. A TIA doesn't cause permanent brain damage, but it indicates a high risk of future strokes. These strokes can cause lasting disability or even be life-threatening. That's why doctors often prescribe medications after a TIA to lower this risk. These medications include blood thinners to prevent clot formation, drugs to control high blood pressure, and statins to reduce cholesterol levels. They target the root causes like atherosclerosis, high blood pressure, or irregular heart rhythms such as atrial fibrillation. Taking these medications exactly as prescribed is called medication adherence. It's crucial because these drugs have been proven to significantly cut the chance of having another stroke. Research shows that combining medication with lifestyle changes can prevent about 80% of recurrent vascular events in people who have had a TIA or stroke. That's a huge difference in protecting your health. However, studies reveal that more than half of stroke and TIA survivors stop taking their medications within months of the event. Sometimes they do this without talking to their doctor. When medications are missed, the protective effect is lost, and the risk of another stroke rises sharply. Even missing a few doses can be dangerous, especially since the highest risk of a second stroke occurs in the first few days after a TIA. But the risk remains elevated for up to a year or more. The benefits of sticking to your medication plan are clear. People who take their medicines as directed tend to have better survival rates and fewer strokes. There is no safe level of non-adherence. Even small lapses can increase your chances of a serious, potentially life-changing stroke. That's why medical guidelines stress starting these medications right after a TIA and continuing them consistently. Many barriers can make adherence difficult. Some people might not understand why the medications are so important, or they might experience side effects. Others may find it hard to remember multiple pills or may not prioritize their health. Support from healthcare providers, education about the risks of stopping medications, and practical tools like pill organizers or reminders can help. It's also important to remember that medication plans should be tailored to each person's specific risk factors and type of TIA. For example, someone with atrial fibrillation might need a different blood thinner than someone with clogged arteries. Regular follow-up with your healthcare provider ensures your treatment stays appropriate and that any side effects are managed. In summary, medication adherence after a TIA is vital for preventing another stroke. These medicines address the underlying causes of stroke risk, and when taken consistently, they offer strong protection. Stopping them without medical advice greatly increases the chance of a recurrent stroke, which can be devastating. If you have questions or concerns about your medications, always talk to your healthcare provider. They can help you understand your treatment plan and find strategies that work for you, keeping you safer and healthier in the long run.